participants and employers expressed very strongly that they didn't want the summit to be a one-off. They wanted to have this be a continuing education around a variety of topics. So we decided we being the State Workforce Board Industry Leadership Committee, decided we'd put on this 5-part webinar series in this year, in 2024. Today, the first one being older workers. And you'll see on the screen there, we have our other 4 upcoming webinars. New Mainers on April 17th, people with disabilities on June 19th, folks in the reentry community on August 21st, and folks in the recovery community on October 16th. So I look forward more information on that. And before we go to our first speaker here, I just wanted to let everyone know that if you have a question throughout the webinar, you can post it in the chat. You can also wait until the very end. We're going to allow some time at the end. And if you can use the raise hand feature, and we will get to you at the end. So you can do it one of 2 ways. And then also in the chat, we have, I think it's in there. In the chat here momentarily, Isaac's going to be posting a short little 1-question survey where you just want to understand how you heard about this webinar. So if you can just, it's 1 question, if you just let us know how you heard about it, it just helps us going forward in that chat. That poll is now in the chat as well. So without any further ado, Isaac, can advance the slide. I'm going to introduce our first presenter. We have Jess Maurer, who is the Executive Director on the Maine Council on Aging. You see her bio here on the screen. Jess has been involved in this work for many, many years. And prior to that was with the Maine Office of the Attorney General and Executive Director for the Maine Association of Area Agencies on Aging. So without any further ado, Jess, I'll kick it to you.
Terrific. Thanks, Christopher. And I'm excited to be here. So you can go ahead and move to that next slide. Great. And obviously, we're going to be talking about building an age-positive work culture here in Maine. You can move to the next slide. And always like to start with a quick look at Maine's demographic. So our median age, as most folks know, is about 45.1, which makes us a leader. I always like to say that. So we're the oldest state in the country by median age. But I like to look at this as instead of seeing this as a problem, really looking at this as an opportunity. What it tells me is that we're doing a really great job at living longer, healthier lives here in Maine. But this number also gives us a really good reason to keep older workers in the workforce longer. Consider that 44% of our entire population, 44% is over 50. 18% of our population is under 18. 23% is over the age of 65. That means we have more people over the age of 65 to tap as workers than we do younger folks. So a smart employer would be doing everything they could to keep the employees they have and attract older workers into the workforce. Next slide. So despite my reframing efforts, this is how we typically feel about Maine's aging demographic. That's because for the better part of the last 30 years, we've been talking about the silver tsunami, literally a gray wave of sedentary, medically needy older people that's going to crash down on our heads and ruin literally everything. Makes you feel really warm and fuzzy about older people. Next slide. So we're working to flip the script on this wave, literally turning the wave upside down into the opportunity that it actually is. This image was drawn in September during our annual summit, where a bunch of leaders who were talking, actually somebody who's on the participant list, I just saw Tabby Queso here, were talking about their efforts to embed ageism and age positivity in their work and their workplaces. We're living longer than ever before. In fact, most of us have gained about 30 new years of life without even knowing it. And we're still embracing the old ways of thinking about work, retirement, and getting old. And I say to my friends who are thinking of retiring at 65, go ahead and do that, but know that doing sort of nothing with purpose for 30 years is good for literally nobody. In fact, quite the opposite is true. People who live with purpose live 5.5 years longer with fewer chronic conditions, less anxiety, depression, better health, all of these things. So there's a lot of good reasons to be thinking differently about what retirement means to us personally, and also why it's great to think about bringing older people back into the workforce. So next slide. So why focus on older workers? For those of you who remember Charlie Colgan, our former state economist, here's how he explained it in a meeting of leaders in 2013. He had said, Maine just hasn't had enough babies. He said, if you'd actually put an ankle bracelet on every child that had been born since 1980, such that they wouldn't be able to leave the state of Maine, we would still be in the same challenging workforce environment simply because we haven't had enough babies. And he got it right for Maine, but he failed to put this trend in a context that I didn't have until a few weeks ago when I was listening to a presentation by an international demographer called Jennifer Scuba. And I realized that this isn't just a trend in Maine, which I kind of thought it was, but this is really a global trend. Next slide, please. So here's, sort of a visual of that. Jennifer's presentation offered that 2 out of every 3 people on the planet lives somewhere with below replacement fertility, and nearly half the countries with rates above the replacement fertility rate are only just above it, with women averaging about 3 children. So not 5 children, but 3 children. So put in other words, even in developing countries, women are having fewer babies, and ultimately this is going to be a shift worldwide. Next slide. So you'll see here that the US is not an outlier. In fact, in other countries like Japan and Germany, who've already gone through this demographic shift, they have sort of significantly narrower trunks with a wide sort of band of limbs above over top, sort of making this tree-like sort of now graph of the way their populations are shaking out. And this is what Jennifer said about this trend. And I had to go back and listen to her presentation over and over again. This is a direct quote. We have a long way to go to get people to understand that this shift toward fewer babies is permanent and not a problem to be solved. That's why I always start by putting this in global context. This is not some fluke. This is not an exception. This is a permanent shift, the likes of which we've never seen before. Next slide. So this is a quote that got my attention most because here in Maine, we've been really focused on in-migration as a solution to our workforce problem. But as this quote clearly demonstrates, as with a declining overall worldwide population and a very low rate of migration worldwide, in-migration is not going to necessarily be the solution that's going to solve all of Maine's workforce problems. Next slide, please. So what if really our focus has been a little misplaced? What if the 2013 Making Maine Work Report was right? What it said is, of all workforce solutions, older workers are possibly the greatest opportunity. Of course, Maine has to do everything we can do to be the most welcoming state in the country, right? I mean, like, we want every person born in this country or any other country, if they're going to move to Maine, right? So we want in-migration. We think that's a great thing. But clearly, these other slides I just offered suggest that it's not going to be enough, right? That we're not going to be able to solve our workforce shortage just by in-migration, and that we probably do need to focus on engaging older people in the workforce longer if we're going to maintain a healthy economy. Next slide. So the 2023 Making Maine Work report seems to agree. It suggests that we have to do a number of things to capitalize on this opportunity that is older workers in Maine. And it includes understanding the business case for older workers and multi-generational workforces, reducing age bias in the workplace, and building a culture of inclusion generally. So next slide. So here's the business case, right? Older workers come with lots of experience and an already established network. We here at the Maine Council on Aging actively recruit and hire older workers. And the folks that we've brought in have brought with them an incredible network. As a matter of fact, they have just made our network so much broader by the people that they are connected to. And by the way, I'm like a really connected person in Maine. And it's been phenomenal, right? So this is something I can attest to, that when you bring older workers into your workforce, they come with some significant resources and skills. They also do, in fact, have significant skills and a great work ethic, and are often applying for jobs that are meaningful to them. And I don't know if, so there's some really great data about trends post 2020, post the pandemic. And folks now are actually looking for work universally, so no matter what the age, sort of starting on meaningful, right? Meaningful work. And so what you'll see for a lot of older people who have left the workforce and are now considering coming back, and that's a big deal for them. They're looking for meaningful work and or work that interests them. So they might have had a big corporate job, and this is where, like, we have to avoid stereotypes. We may think, oh my gosh, as a matter of fact, I actually heard, I actually was talking to a producer at a TV station, and she said, well, I can't afford older workers. And I said, well, if you publish the salary, which is the best practice, publish your salary, and you have an older worker who applies for that, that means that that person is really interested in an entry-level job, because maybe they did something totally different their entire career, and this is the one thing they really wanted to do. And so we let our stereotypes get in the way of really understanding what the business case is. I'll also say that, talking about stereotypes, right? One of the big stereotypes I hear all the time is that people don't know how to use technology. Older people don't know how to use technology. And I like to remind them that many of us, have been using and adapting new technology for 40 years, 50 years. As it's come out, we've learned how to use new things over and over again. And so are quite adept at adapting to new technology and learning new technology. Also, I hear people say we can't afford older workers. And I like to say, well, anybody over 65 is actually on Medicare, and it's a cost savings. So you don't have to provide insurance to folks who are over 65 and they're on Medicare. I like to say it's a good idea to give them something toward their Medicare expenses, but it is actually a cost savings when you're talking about folks who are on Medicare. Next slide. There's also not only this opportunity, right, to bring in a lot of wisdom and learned experience of older workers. They can, in fact, act as mentors too, and share that experience. But they're also used to working in teams, and often are good at shifting between leader and follower. And together, older workers and younger workers can bring, like, sort of this idea of an old idea and a new idea, put it together to solve challenges, or maybe even find new ways of doing work. Ultimately, like most people like living in multi-generational neighborhoods and having friends of different ages. And so a lot of workers are attracted to a multi-generational workforce. And here's where I say, particularly um, in relation to age bias, we're just about to jump into that. Younger women, and this has sort of surprised me in all of the work. We get into a lot of conversations with employers all over Maine, and we often will go into small groups and talk about, sort of what we've been talking about around age bias. And women, in particular, in their 30s, chime up right away and say, yo, oh yeah, I'm already hiding things on my resume because I took time off to raise kids, and it doesn't make me competitive in my field. So they're already changing their resumes at 30, already feeling pressure to be young, to be competitive. And so think about that. If you have an intentional multi-generational workforce where your message is everybody matters here, and we value everyone in our workforce, no matter how old you are, whatever your experience is, we value that. That takes that sort of whole competitive process like right down. It makes it much more comfortable for people who've had normal life experiences to feel comfortable in the workforce setting without having to change who they are and what their experience has been. Next slide, please. So the next up, the Making Maine Work report says that we have to reduce bias in the workplace. So according to AARP, 64% of workers say they have seen or experienced age discrimination at work, 64% of all workers. 58% of adults believe discrimination against age begins among workers in their 50s. And because employers are consistently failing to hire older workers, we all pay the cost. Consider that bias against older workers costs U.S. economy an estimated $850 billion in gross domestic product in 2018. So that's, a pretty big number today. And what I will tell you is that, as I mentioned, we talk to employers all the time, and and it's a little embarrassing because we talk about ageism and age bias, and then we'll often ask people to get into small groups, as I mentioned, and say, so how does this impact your mission, your vision, the work that you're doing? How could ageism show up in your work? And then we'll have people report out. And I will say, a fair number of times, people will report out that they are actively and unknowingly participating in illegal age discrimination, not just age bias, which is what we thought we would just kind of learn and sort of uncover. But people will say, oh yeah, I didn't realize, I never ever consider somebody older for XYZ job because they're working with younger people, and we didn't figure that they would get younger people or would get this issue, or they're too hard to train. They take too long to train. I won't go into all the stories, but I've heard a lot of stories about how people actively are not even considering people over the age of 50 for jobs because, particularly around training and technology, they have these internal bias stereotypes that have become acculturated within their institution, and they are actively avoiding hiring people over the age of 50. Next slide. So how do we reduce bias? One of the ways we talk about is starting with ourselves, right? So we have to understand that we all have age bias. Like 100% of us are ageist and have stereotypes in our brains about older people. And so what happens, right? How does this work? Well, we take those stereotypes we have about older people and we bring them to work, and then we feed them to each other, right? I mean, it's just pretty much normal. It's the way all bias goes. And so we need to learn about age bias. We have to understand how it works, what the impacts of age bias are, and then we have to be intentional about eliminating age bias in our work. So I'll give you an example, right? You could be a 55-year-old person, and you could have parents who are in their 70s, and they don't know how to text, right? They've never been interested in cell phones. They still have a landline. They don't know how to text. Well, you might consider, they'd be like, no way would I hire somebody in their 70s. They don't get technology, right? I mean, that's like real experience. But what happens is I have that experience. I associate that with all older people. I don't even think about it. And then I think I can't possibly have somebody that age come in and do the work that I need them to do because I need them to be cool. I need to be the digital natives. I need them to be ready to do all the technology that we need them to do. So think about the ways that we personally might come into a workforce and bring ageist thoughts and actual words with us. One of the things I like to talk about is senior moment, right? I have lots of friends who use this term. Well, what does that mean? What does a senior moment mean? It literally means that we personally think that losing our memory is a normal part, an inevitable part of aging, which is totally not. But we reinforce that idea over and over and over again. Actually, Don Harden, who would be giving this presentation had he not been leaving for France tomorrow, who leads our leadership exchange on ageism, he tells the story, and I'm just going to tell a story because I love stories. But so when he first started working in Maine, he worked at Catholic Charities. He was in his early 30s, and one of his coworkers said, "Hey, my car's in the shop. Would you take me home tonight?" So Don got home and he realized, oh my God, I never took Joe home. And he felt so bad, and he just thought, I'm so stupid. I can't believe I didn't remember that. Well, fast forward, he's in his 60s. He's at the State House all day long for a public hearing and doing advocacy. And he comes out of the State House and he can't find his car. And he goes up and down the State House. Anybody knows, the parking garage in Augusta at the State House. He can't find his car. And he thought, okay, it's happening. All right, I'm getting dementia. I can't remember where I parked, right? So this is the internal messaging. So when he was 30, he was stupid. When he was 60, he was having, right, a senior moment. His car had been towed, by the way. I mean, like, so, but so we all, sort of have these contexts that we just repeat over and over again because we believe them and then we share them with other people. And that's how we end up building a culture that says older people all are going to lose their memory. Older people are all slow. Older people don't get technology. And so literally we've got to start saying, all right, whoa, what are our internal messages that we have that we're bringing to work that might be showing up in our workflows? And then how might we be able to intentionally change them? So next slide. So here are some ways that we encourage folks to think about, sort of what's next. What are some steps you can actually take? One is to at least train your HR managers and your supervisors on ageism and implicit bias. If you have a diversity, equity, inclusion program, please include age. Only 8% of corporations nationally who are doing diversity, equity, and inclusion work are including age. And it is one of the most pervasive forms of bias. And when it interacts with other forms of bias, can be particularly harmful to people. Also, implementing age disruptors, thinking about, do you have a job application and does it ask age? Or graduations, not age. Age is an illegal question. Graduation date, which is essentially the same as asking age-related questions. And if it does that information actually provide you any? And there are a few age-specific jobs in the world. I think you're not allowed to fly a jet over the age of 70. Okay, well, so there you go. Would that be a good reason to ask, a specific question? But mostly that kind of data results in unintentional age or, sort of subconscious age bias if you have that information. And then just looking at your workflows, but also your job descriptions and your job postings, looking for age bias and how you are crafting your messaging about who you're interested in bringing into your organization. So next slide, please. So really to build success here, it's about being intentional. And so being intentional about wanting to bring older workers in is really important. So saying something like seeking workers of all ages is really important. But also like, what are the images that you're portraying? I mean, I shop at Hannaford most of the time. Sorry if there's anybody here from Shaw's. And I walk in and I look at their marketing posters about who you want, and they do a great job, right? There are people who are disabled there. There are people who are different colors there. There are people who are older and younger there. And that's the kind of thing, if you can't see yourself, if you don't see yourself in the ad, you don't think that you're welcome. More importantly, we actually can include some flags in our advertising that suggest we don't want older people to apply, right? Fresh digital natives, right? These are things that are suggesting we don't want dinosaurs here. And asking questions, right? What's the standard question? Where do you see yourself in 5 years? You're going to ask somebody who's 65 that question. And what does that help you in understanding? Another thing that, in terms of work culture, asking people consistently, when are you going to retire? Really signals that you can't wait for them to retire. You can't wait for them to leave, that there is an expectation that they are done their useful life. And I will tell you, it's one thing you could change immediately. Older workers hate being asked that question over and over and over again. And it comes from every side. So, really, that's when we say train your HR directors. It's really important to talk about these things. It's not just about the questions that are asked in recruitment and interviews, but also the culture. So next slide, please. So this is where I like to say everything I'm talking about applies to everybody. Actually, more importantly, what younger workers want, particularly today, is also what's really good for older workers. So younger workers, what do you know? Particularly younger workers want to be valued just as much as people who've been in the workplace for a long time, right? Their ideas are just as important and valid as older workers. Well, older workers also want to feel valued. Younger workers want flexibility, particularly again after COVID, and that's exactly what older workers want. When you have a benefit that you think will attract younger workers, i.e. a childcare benefit is what usually is something, or parental leave, not mirroring that not only doesn't help older people see your organization as a multi-generational sort of equal to everybody, but not so providing equity, not equality, right? So if I don't have a child, I can't get that benefit, but I might be taking care of an older parent, and I might actually really need an adult day program benefit or a home care subsidy benefit that an employer can provide. But again, we tend to think that's just for older people. And the reality is the people who are most pinched right now are the people in the middle. You've got all kinds of folks who have teenagers at home. They don't need childcare, who are leaving the workforce because they can't find home care for a parent or can't afford home care for a parent. So getting employers not just involved in the child care, right? That's a Chamber of Commerce, #1 thing, increase childcare. Well, what about adult home care? What about adult programming, daycare? We've got actually 6 counties in Maine don't have any adult day programming. Means if you are taking care of a person with dementia in Piscataquis County, you can't even use that service. So these are the kinds of things that we, sort of say, if you're going to create a benefit for one, you need to create a benefit for others. It might be a different benefit, but it definitely needs to happen. We'll also say that don't make assumptions about what's next. Some older workers are not retiring. They're gonna potentially start new businesses. As a matter of fact, the #1, all of the vast majority of people who start new businesses in Maine are over 50, right? So this is I did my job, I did my stint in working for an employer, and now I want to start doing X, Y, and Z, right? I want to start my own small business. And so let's not make assumptions about career counseling, right? So we could offer career counseling to older people as well. And, we might also include the concept of volunteering for everybody, not just for older people. And by the way, everyone ultimately is going to stop working, i.e. retiring, although we call it refiring. And so, everybody needs counseling on retiring. Even 20-year-olds should be thinking about their future and creating goals. So an employer that's, again, really trying to be multi-generational is thinking about how do we make this good for everybody. Next slide. So we're finally seeing some good numbers, finally, in sort of a decade of working on this, are seeing that both Maine employers and I think Maine workers are getting it. So we're seeing increases in the number of people who are between 65 and 74 who are working in Maine. So that's really good news, but we have to continue that. And the way we do that, right, is as it says in the State of Working Maine report that just came out, empowering older Mainers to work if they want to will require a thoughtful and nuanced approach. So next slide, please. And I won't cover these, but I'll say there are tools available. There are great tools about. There have been great tools available. We need employers to use them. So, so here are some tools that you can use that are particularly useful to you, and we'll share the slides. I assume that Christopher will share the slides with the folks who are here today. So I'm not going to go over those. I'm just going to say the next slide. But I do want to say becoming a certified age-friendly employer is a great thing to do. And the state of Maine has just done that. It became the second state in the country to become a certified age-friendly employer. It took them a lot of work, actually months of hard work of changing their policies, reviewing their policies, changing their policies. And then we've done training with all their HR folks, and we just did a training for all state workers, actually. And what I can tell you about our own work internally around ageism, and also through that conversation, actually, is the most engaged group of people. About 250 state employees were on that training, totally engaged and really wanted to talk about this. And that's what we have seen over and over again, is that there's no space for employees to talk about age bias, the age bias they've experienced, how they're feeling about being pushed out or being, sort of made to stay. Both of those things are bad. But really, employers giving employees the opportunity to learn about ageism and age bias and to talk about it creates all sorts of opportunities that, as we've experienced, that we don't really we don't expect, and creates a much richer sort of cultural environment. So next slide, and this is my last slide, which is to just say we're here to help. We're happy to help in any way that we can. We offer trainings regularly, and we also have a leadership exchange on ageism, which is a 14-hour intensive peer learning participatory program. We're actually tomorrow, Friday, we'll graduate the 200th leader who's gone through the program, and it's a very effective tool to help you think about equity generally, not just as it relates to age. But would be happy to talk more with any employers who are interested in those things. So I'll stop there. Happy to answer questions and turn things over to our presenter at Northern Light.
Jess, you do have some questions in the chat box. Would you like me to read them to you?
Well, let's go through Catherine, and then right at the end we'll come back to the questions. Liz,
Okay.
Thank you very much. Jess, thank you very much. That was incredibly detailed and useful information. I hope everyone found it so. Isaac, if we can go to the next slide. I'll introduce our second presenter. So before I do that, though, I want to remind people, if they do have questions, to go to the Q&A feature at the bottom of the screen. I think I said chat at the beginning of the call, and I'm realizing it should have been Q&A. And then also, if at the bottom of your screen, you'll see a little tab that says polls. That's where the poll is. It's not in the chat. I'm realizing that I said both those in the chat, and neither of them are in the chat. So if you go to polls and just answer that one question poll, so we can have a better understanding of how you found out about this, that would be great. Next, we have Catherine McLaren. She's the Vice President of Talent and Diversity and Human Resources at Northern Light Health. So our thinking here was, and Isaac can go to the next slide, so we would get some great information and data from Jess, and then let's hear from an employer who's actually put some of these practices in place and has seen success. So Catherine, take it away.
Thank you. So I am delighted to be here and talk about this topic. I have I've spent part of my career doing a lot of research around older workers and helping people age in place and all kinds of related topics. And I have 2 slides. So this will be relatively quick. I can go into some detail. I've already seen the questions, and I think we can do a good job of trying to answer them and add context. And so the first slide is why does Northern Light Health have a commitment to hiring and retaining older workers? And I will say that I didn't even bother putting on this slide, like, because we know what our population looks like, because I knew that Jess would do a wonderful job in describing all of that, for Maine, nationally and internationally. And this is the reality in which all of us want and need to be successful. It is interesting to me because I wasn't aware. I think what I saw was 44% of the Maine population is 50 and older. And I can tell you that Northern Light Health's workforce, 37% is 50 and older. So I see some alignment there. And then about 26% of our workforce is 55 and older. So it's a good, over a quarter. So some of the reasons that we are really committed to hiring and retaining older workers is certainly diversity. And really, as I was listening to Jess talk, it really is a lot of what has already been mentioned, but also experience and reliability, commitment. There was mention of sort of the ability to mentor and also just kind of life experience, right? So one of the things that we look at for our workforce is people's ability to kind of, have perspective on work and disconnect from work. And what we often find is some of our older workers, however we're defining that, have a lot of life experience that sort of supports and helps with that. And we have a very robust mentor program. Transferable skills like critical thinking, decision-making, and problem solving, that we talk a lot about crosswalking from other professions. So, there was a time, I think, where a lot of our hiring managers, and this was, quite a while ago, but we're looking specifically for people who had the actual skills, practical and technical skills. And of course, in healthcare, some of that is really important. We can't practice healthcare without certain skills. And I think I know what we've really been emphasizing and talking about and training and, discussing is that to a certain extent, some of the practical and technical skills can be learned relatively easily. And what we're looking for are some of these other skills, the critical thinking, the decision-making, the problem solving, which a lot of people who have had various careers or, certainly life experience bring into the workplace. Certainly a tremendous amount of knowledge, life knowledge from other industries. It occurs to me, I was in Washington, D.C. a couple weeks ago, and I was talking to a friend who's in a profession, not in healthcare, where they actually get incentivized pretty significantly to retire at 62. I would say in that industry, it's because they are getting paid a lot of money. So the organization is keen to sort of like, thank you very much, please transfer your knowledge and then go. And it was interesting because we were having a discussion. She said, I feel like, I'll do that most likely because it's a great incentive. And then I can actually do something I'm also passionate about, but I won't. And so I guess this sort of somewhat speaks to Jess's point. It'll be more a passion project at that point than other stuff. And it's not that she doesn't enjoy the work that she does, but, she was like, I figure I have 20 more years to give potentially, and could get really excited about all kinds of things. And then also, we think and talk a lot about, are the people providing services on the employee side? So, we have about 11,000 employees. Is it reflective of our patient population and our communities? And that becomes very important. And as you saw with the data that Jess shared, 44% of our population are 50 and older. So there's some synergy there. People want to serve their communities by and large. And, you know, a lot of people who come into healthcare come into it to be of service and to do something that feels meaningful to them. I can think of lots of examples. And I haven't asked anyone's permission, so I won't name anyone, but of colleagues I know, you know, throughout Maine who were doing something else, they retired from that. And, you know, I actually just ran into someone recently who's now doing patient transport as a part-time, you know, gig at one of our hospitals because he really enjoys interacting with patients and helping them when they're discharged, getting them out to their car and, you know, lots of examples like that. So if you go to the next slide. So what does our commitment entail? And I think this is really important because I think it's easy to say, oh yeah, no, we're completely supportive of, you know, hiring whomever and retaining whomever. But then, you know, the question becomes, well, what are you actually doing to make that happen? So this is a perhaps not exhaustive, but a comprehensive list. We definitely look at flexibility for people. And what you'll notice, and I think is important, is that some of the things on here are not specific to older workers. They also meet the needs of other segments of the population, but they certainly are attractors for some older workers and help us retain them. And one good example is that, you know, we do have a small section of our population who really want to work in healthcare when they're here for part of the year. And then they go elsewhere, usually in the winter months. And so we have the ability to have them come and actually stay on as employees throughout so that they don't have to go through the whole process all over again. Understanding that, you know, that's great. If you want to come work with us for the 4 or 5 months that you're here, please do that. And then part-time per diem, which is not to suggest, I just want to be clear that older workers don't want to work full-time. That's not my point. It's more just the flexibility. And actually, I'm thinking now, Jess wasn't in our planning call, but I think I mentioned there that I had just seen an article in The Economist about essentially why no one should ever want to retire. To your point about, you know, and it's not that people can't have meaningful retirements. I used to run a workshop called the non-financial considerations of retirement. I will tell you what was really interesting about that, this was years ago, is that as how many people said, I retired thinking I had all my ducks in a row because financially I was okay, and then realized about 2 weeks, 2 months, 2 years in, that I hadn't thought about what I'd actually be doing with my time. And a lot of them were coming back to the workforce because there was something about that was meaningful for them. It doesn't mean that everyone wants to, it just means that for some people, it's super important. Rethinking work assignments, right? I mean, I would say for anyone, sometimes when you've been doing something for a while, you maybe want to switch it up. Some of healthcare is very physical work, and that can take a toll. And so sometimes people say, you know, I'd like to stay in healthcare. I don't know that I want to do literally some of the heavy lifting I've been doing. Is there something else I could do? And we're a large enough organization, thankfully, that we can often be flexible and have plenty of work for people to do. Also retraining opportunities. So we invest pretty considerable resources into sponsorship, what we call sponsorship programs, but kind of earn while you learn, training people up on the clinical side who are interested, and we don't put any kind of expectation or cap around ages, right? That's open to anyone who's interested, and that's any, you know, CNAs, MAs, RNs, etc. We work a lot with organizations serving veterans and others who have, for one reason or another, including, you know, Maine DOL, who are transitioning out of something else and may be interested in coming into healthcare. And we have some people on our team, on our talent team, who are really, who are the point people to work with various organizations to help that transition and to figure out, okay, what are the transferable skills and what might be a good fit based on what this person is looking for and how much they want to work, etc. We don't require age identifying dates on applications. That's not something that, I mean, people sometimes supply that because, you know, but it's not a requirement to apply for a position. We do some programming around generations working together. So again, this isn't specific to older workers, but this is really about how can all generations sort of come together and leverage their interests and skills and sort of personalities and what have you for collaboration and the best teamwork. And actually, I'm thinking, you know, Jess made a really good point about, you know, there are lots of older people who have kept up with technology, which is completely true. Other thing that was someone mentioned to me recently was, you know, for older people who have had children and now have grandchildren, how do you think they stay in touch with their grandchildren? Like they are forced, even if they don't want to, they are forced to learn, you know, and actually their premise was there are probably more older people who are better at technology than some others who, you know, don't need it as much. So anyway, robust retirement benefits and counseling. So one of the things that we focus on a lot are retirement benefits, and also sort of counseling people and how to plan accordingly and think about that. So when that's relevant for people, we also offer access to will and legal and elder care resources. And I say this not because I think that if we have an older worker, they're looking for elder care resources, but because we have a lot of people in that sort of sandwich generation who are caring for older people or feel responsible for older people, whether they're in Maine or elsewhere, and are tasked with trying to help support those folks. And so we try to provide benefits to really help them. We do use multi-generational images in our recruitment materials, and we're very intentional about that. And sensitivity and language about how we, you know, I'm a social worker, so I have done a lot of research around job postings and sort of around gender stuff, and also around ages stuff, and, you know, all kinds of things around what certain words can indicate, whether it's intentional or not. And so we try very hard to be mindful of that and to make sure that we are using language that is as inclusive as possible, so that no one, you know, reads a job post and thinks, well, that's clearly not for me for a reason, not like, you know, obviously if someone needs certain credentials and they don't have them, that is a legit reason that someone probably shouldn't apply for that job. But we don't want someone not applying because we've used language that is somehow alienating or othering to them and makes it seem like they wouldn't be a good candidate. We do hiring and general trainings on implicit and age bias. Of course, we include other biases in that, but that is certainly one that we talk about quite a bit. In general, we have increased our wellness and mental health benefits. Again, this isn't specific for older workers, but it's something that seems to have become especially important in the last few years. And we have really made those benefits a lot more robust. And then the other thing, and I'll stop here because I know we want to get to questions and answers, is we do an annual review of benefit trends by generations. So, you know, what's the literature saying, what's the research telling us, and then really doing a deep dive into the benefits that we offer and trying to make sure that we have a benefits package that appeals across generations, with pockets of offerings that you know, according to the data, will tie specifically to different groups. And I'll say one last thing, which I think is interesting. I was looking at our engagement survey data. We do an annual one. And what I was struck by, because we can look at different age groups, is that our biggest engagement is with workers 50 and older in terms of their satisfaction and sort of commitment to work when you look at every group. And that says something. And I think at that point, for a lot of people, they're doing work that feels meaningful to them. And there's some stickiness to that in terms of their staying around until, you know, they either decide they don't want to work or maybe they go do something else. So I'll stop there.
Thank you very much, Catherine. I do appreciate it. And finally, we'll just take a few minutes here. I invited Liz Nitzel to come. Liz is with our within our Division of Vocational Rehabilitation within our Bureau of Rehabilitation Services here at MDOL. And I thought she could just, we've got one little slide where she just has some resources that she can share with you all. And then what we'll do is there's a couple questions that I've kind of categorized here. We'll answer a couple questions and then we will sign off. So Liz, the floor is yours. You can go to the next slide, Isaac.
Thank you so much, everyone. Basically, throughout this entire presentation, we've heard about universal design for including all employees, and we need all employees. So I've just got a slide that will assist you with resources for anybody who may need an additional resource. We've got inclusive practices to make sure that the tools that you're using are accessible to everybody. And then I've shared Ask Earn and Main Site. And I think I had Ask Jan there too, but it's disappeared. I'll stick it in the chat box. These are different sites that can help you look up questions that you have. For instance, if you need some additional assistance with reading the computer screen, what are some different tools that you could use? There are tools for pretty much any need, and you'll find it there. I'm going to move forward now, but we also have vocational rehabilitation. If anybody's wondering how to overcome the barrier that could be disability related, reach out to us and see if we can help you. Thank you so much.
Thank you, Liz. And then just further, there are other resources available at our website, whether you can go to the maincareercenter.gov and get all kinds of information about promoting updating, promoting job postings, hiring events, et cetera. And then we do have a page specifically on older workers, and the URL is right there. And again, we will share this presentation with everyone here at the end. But I wanted to I think there were a lot of good comments, a lot of great comments on here. I want to thank everyone for that. And there were a few questions that I wanted to get to while we have a few moments. And if we don't get to your question, I will make sure that in the materials we send out after, we will answer those questions. But so it was mentioned that that folks shouldn't ask an older worker when they are retiring. And I'll throw this out to anyone who wants to answer this. And the question is, how would you suggest reframing this to getting the information they need for succession planning, right? Companies need to work on succession planning and want to know that, and they're interested in how they can reframe that question. So anyone wants to jump in and answer that?
I'm sure Jess has a response. I would say what we do is we ask people what their plans are. I mean, you know, we have regular check-ins with people. Of course, we do succession planning for a lot of our roles, but essentially, rather than when are you retiring, we ask, like, what are your plans? What are you interested in the next couple of years? In my experience, people tend to be pretty transparent. They'll say, I'm planning to retire next year.
Yeah.
You know, or they'll say, like, I'm never retiring and you're going to have to kick me out of this place. And you're like, okay, good. Let's talk about then, you know, do you like doing what you're doing? Do you want to think about doing something else here?
Yeah, I'll just emphasize that it's really about treating all of your employees the same, because any of your employees could be thinking about leaving, right? And that's the question: is what, you know, sort of what are your plans? Are you planning on sticking in this job? Do you want to change to a different job? Are you happy with the work that you're doing currently? I mean, I've actually asked my employees, who are of all different ages, what brings you joy in the work that you're doing, and what are things that you would get rid of if you could get rid of? Because I think, you know, it's healthy to sort of see, are there ways that you can, for instance, actually, Catherine, I'm sure you know this, right? I mean, nurses in particular, like, hate necessarily doing all of the work, the data entry work, right? And so if you think about how can I increase my satisfaction with my job by being able to see patients more and put less time in front of a screen, and thinking about, workflows. All these things are really all tied up in asking those questions, right? Where, what are your plans? I love the way you do that, but also, are you feeling good in this? Are you, are you happy with where you are? Do you want to shift in any way? So bigger questions.
Great, thank you. The other question is, how would you determine whether a prospective employee is willing to make a long-term commitment to a job? And what are some appropriate questions to ask that would give a prospective employee that you're interested in hiring, and who will be working for you for more than a year or so? So really looking at that, as employers, you want to have those employees who stay a long time, or to ensure that all that training, that great training you provide, is being utilized. So what would be a way to ask them if they're willing to make a long-term commitment?
This is such a good question, because I hear it from our hiring managers all the time, right? They'll interview someone and they'll say, I'm not sure they're going to stay more than a couple of years. And I say, do you know what the data tell us? That if we can get someone to stay for 2 years, that's a win, right? Given, and actually in our experience, some of our older workers stay longer, right? So Megan, I'm not sure if that's how you pronounce your name, but I think it is a question of sort of what are your future plans? What are your aspirations? If someone says, like, I know for a fact I'm going to go back to school to do something completely different next week, that might be an indicator. It might not, right? I mean, the thing is, you can ask, are you going to stick around? But what I am more inclined to ask is, what kind of workplace are you looking for, right? If you're looking for growth, what are you looking for, so that I can figure out how I'm going to try and support you in that, so that you want to stick around. But Jess probably has something to add.
I think your answer was so perfect. I think it's exactly right. And I think it's understand the trends within your industry, which is what you just said, like what your turnover rate actually is and what you are looking for. What do you need personally? I mean, I'm a small nonprofit, right? We have like the equivalent of 9.5 employees, right? So it's a very different thing. It's a lot of work for me to hire somebody, right? I don't have an HR director. I don't have, so what is your pain point? Like, what are you looking for? And then, ask that question. I used to ask it in a different way. If you come to work for us and it's a good fit, do you think you would be able to commit to staying in the job for 3 years? I mean, if that's what you're hoping for and that's what you would like to see, that's a very reasonable question. You can ask that question of a 24-year-old or a 74-year-old, right?
Great. Well, thank you very much. I want to thank all of our presenters, Jess and Liz and Catherine. I want to thank the folks who attended. We're very happy to see the numbers that we got here today. And I just want to remind folks, we will have more of these coming up. Our next one will be coming up in April. And then all of the materials from today, the presentations and the great comments and questions and resources will be provided to everyone who registered, as well as we will be posting them on the State Workforce Board's webpage, which we will make sure everyone has access to. So thank you all very much, and hopefully we get a chance to talk with you in April. Take care.